Okay, so we're going to get started. So this month, our in-service was on understanding congestive heart failure. So congestive heart failure, or CHF, is a chronic condition where the heart struggles to pump blood effectively. This can cause fluid buildup, leading to swelling, fatigue, and some difficulty breathing. As caregivers, you play a vital role in recognizing early symptoms and helping clients manage their condition. CHF can develop from many different causes, but some of the main ones are severe lung disease, uncontrolled diabetes, toxic exposure to drugs or alcohol, old age, thyroid disease, pregnancy, viral infections, and severe anemia. Also, lifestyle factors like poor diet and smoking can also lead to CHF. When the heart can't pump efficiently, fluid does build up in the body, making symptoms worse. So understanding all of these causes helps us support our clients in managing their condition. Now we're going to go into talking about sorry, we just got some more people coming. Now we're going to go into talking about symptoms of congestive heart failure. So often the first symptom with congestive heart failure is fatigue, but it goes unreported. It is caused by lack of oxygen and nutrients reaching the muscles. People may reduce activities due to fatigue, which delays diagnosis. Monitoring your client's fatigue levels can help with early detection. Clients will feel tired even after they've rested. Their heart isn't pumping efficiently, which reduces that oxygen supply to the body. So you want to encourage clients to take breaks and avoid overexertion throughout the day. Another symptom is shortness of breath. So dyspnea at rest is shortness of breath while sitting or resting. Dyspnea on exertion is shortness of breath with activity. Orthopnea is shortness of breath when laying down. So clients are going to want to adjust their activity levels accordingly to whatever symptoms they have going on with this shortness of breath. Fluid buildup in their lungs does make it harder for them to breathe. They might struggle with activities like walking or talking or even just lying flat. So if a client has worsening shortness of breath, you want to make sure that you notify the office immediately. Sudden weight gain. So rapid weight gain is a key sign of fluid retention in CHF patients. And then you want to make sure you're monitoring, because a gain of 2 to 3 pounds in 24 hours or 5 pounds in a week has to be reported. Daily weight monitoring does help detect worsening symptoms before they become serious. Also, clients may have an intake and output log that you want to be making sure you're writing down all of their fluid intakes and outputs. Some other possible symptoms of CHF do include memory loss and confusion, palpitations, coughing, and abdominal discomfort. In addition to the swelling, coughing, and dizziness, some clients may experience confusion due to reduced blood flow. So CHF symptoms can come on gradually or suddenly. So we want to make sure we're paying very close attention to changes and communicating concerns is key to preventing emergencies with our CHF clients. Knowing how CHF is diagnosed is very important as well. Listening detects abnormal heartbeats and crackling lung sounds. They might get some imaging done, like chest x-rays, ultrasounds, and ECG. Stress tests may be used to see how the heart responds to activity. So understanding these tests can help us explain procedures to our clients and help ease their concerns, because a lot of times you'll have a client that has an upcoming test or procedure of some sort, and they're going to have a lot of anxiety about that. So having some sort of knowledge about what they have going on and how that can be diagnosed and what their tests are going to be can really help you with calming their anxieties. Common medications for CHF are diuretics to help reduce water retention, ARBs to treat high blood pressure, ACE inhibitors to relax blood vessels, vasodilators to help blood move through the vessels, and then beta blockers. They help slow the heart rate and reduce blood pressure. Clients may take medications like diuretics, that was for the fluid buildup, beta blockers to lower the heart strain, or the ACE inhibitors to improve that circulation. So it's important to make sure we're reminding our clients to take those medications as prescribed. And you also want to make sure that we're watching for side effects. If a client experiences any dizziness, swelling, or other concerns, you want to notify the office immediately. And if there's any changes to medications that you notice that they're taking that aren't listed on their medication list in the app, you want to make sure you notify the office to just let us know that there's been a medication change or a medication added on. So lifestyle choices can greatly affect CHF clients. So unhealthy foods like processed foods can lead to high cholesterol. High salt intake causes fluid retention. Lack of exercise worsens heart failure. High blood pressure is a major risk factor. Smoking is linked to heart disease. Diabetes, if left uncontrolled, does worsen CHF. Alcohol and drug use will damage the liver. Stress raises blood pressure. And depression is linked to heart disease as well. And obesity adds stress to the heart. So a low sodium diet, regular but light physical activity, and avoiding smoking and alcohol can help manage CHF. Stress can also make symptoms worse, so encouraging relaxation techniques can be beneficial. Small changes can make a big difference in a client's quality of life. Helping clients with CHF. So our role is to support clients by helping with daily tasks, ensuring they follow their care plan and monitoring symptoms, encouraging them to rest, stay hydrated, and take medications correctly. These can all help prevent hospital visits, and simple actions like these on our regular visits with them can make a huge impact on their well-being. In addition to that, the daily weight monitoring to check for fluid retention, monitoring those pulse rates and breathing difficulties, making sure that their respiratory rates are falling within line, and making sure that they're taking those medications. So managing CHF clients' fatigue and stress is very important as well. So we want to make sure we're encouraging light exercise if they're not short of breath. We want to alternate activity and rest periods. Help them with finding assistive devices or shower chairs, elevated toilet seats, shoehorns, devices that help make it easier for them during the day to help reduce that fatigue. If you notice that your client is experiencing more fatigue than usual for them, you want to report that to the office. Encourage social visits, listening to music, laughter, relaxation. You want to help support their mental well-being with patience and care. Because CHF clients may tire easily, we want to encourage frequent rest breaks, avoid pushing them too hard, move slowly and mindfully so we can prevent dizziness or falls. We want to provide emotional support because that is just as important as that physical care. CHF can be very frustrating for our clients, so we want to try to be as supportive as possible for them. Some final facts about CHF. Heart failure risk does increase with age. Mild heart failure can go unnoticed. Severe heart failure affects mobility and breathing. CHF does affect men and women equally, but it progresses faster in men. People with diabetes are 2 to 8 times more likely to develop CHF. Symptoms may not appear for years, even if they have the condition. So while CHF is a serious condition, it can be managed with proper care and early intervention. So by recognizing symptoms early, encouraging good habits, following medical advice, we can help our clients live more comfortably. So your role as a caregiver is essential in helping keep clients safe and supported. So I'm going to go ahead and I'm going to open it up so people can talk. Give me just a minute. Okay. All right. Just trying to get this unmuted here on my end. There we go. All right, you're going to have a prompt up. It's going to ask you to unmute. You guys can click on that and unmute yourselves. All right. So you guys can take some time. We can discuss any experiences or challenges that you guys have had with CHF clients, any concerns or questions that you have. Sharing any experiences can absolutely make us all provide better care to the clients. So you guys can go ahead and take some turns and talk.
If a client, this is Linda, if a client is exhibiting some of the symptoms of CHF but has not been diagnosed, do we just report that to the office, or do we encourage them to see a doctor?
You can absolutely, I would say, report that to the office.
Okay.
And then that's something that we could maybe talk to the client's family about or talk to the client directly. But
Okay.
definitely monitoring those symptoms, reporting if you suspect anything to the office is always a good place to start.
Okay.
And Tanya, that would be a good place at the end of your shift to do the change of condition.
Yep.
And that way Denise and myself in the office can go out and look at it and check him out.
So I had an this is Pablo. I had an experience recently with my one of my clients. Unfortunately he died, but he he was getting really fatigued. It started in about earlier this year. I want to say it was like February, March. I'm sorry, last year. And I reported it, and we took him to the heart doctor. We did everything. You know, they did tests, and everything seemed fine. They had said he was 89 years old. He was a vet. He had so he had cancer, melanoma on his face, and he had the radiation on him, and he ended up going. But at the end of it all, he had the melanoma before had spread all over his body, and it had done the congestive heart. I felt guilty for a while, but at the end of the day, I mean, there was nothing I could have done. But I guess with him, I did everything right. But is there another way? I mean, how do I ask this? Is there a once we tell you, I guess, is there a better way for like doctors to sort of figure out what's going on with it, or is that just something that we hope the doctors figure out?
First, hi, Pablo, it's Aubrey. I just want to say that what you did for that client was amazing. He did not want people coming in, and he accepted you and you helped him no matter what his condition was. We take care of adults that make up their own minds on how they want to, live the rest of their lives, but you enhanced his life so much. And what we would do in the future, if you have questions on how they're managing things, is let the office know. I can't talk about the change of condition, because we can talk to him and his family and his primary. But as of him, you made him very happy and you helped him so much. So I think, and you reported to the office on any changes, which was great. And I think it's hard to remember that we take care of adults who can make decisions, even if they don't want to make the exact right decision that we think they should do for their health. But you did a great job.
Thank you, I appreciate it.
What makes them not be able to sleep? This is Angela. I had a client that couldn't sleep. He kept, all night. He would sleep for a little while and then wake up. So what's the cause of you not being able to sleep?
A lot of seniors have a hard time sleeping at night if it might be they're getting too much rest or laying flat. It's something that we can discuss, and if you notice a trend of, that they're not sleeping, let us know because we might be able to try a few different things or talk to them. It might be something during the day they're resting too much during the day, or their primary might be able to get them on some kind of regime where they can sleep a little bit better.
Yeah, I think with him, it was the first time I was with him, so I'm not really sure how usually. And he just came home from like assisted living, so maybe he was sleeping too long there.
And that's hard too, coming from one place and going home. Sometimes it takes a little bit to reset up their routine.
Yeah.
Does anybody else have anything? No?
I'm almost
All right.
done.
I'm gonna move on. We're gonna get this wrapped up here. We do have a few announcements that we wanted to go over with everybody.
If you're 19 or older, we start running.
All right, so
You're fine.
we have a really special opportunity coming up here on February 26th. It's National Letter to Elders Day. We're partnering with Letters Against Isolation to send heartfelt letters to any seniors that are feeling lonely. If you think about the clients that you work with, sometimes even a small gesture like a kind note can make a really big difference for them. So if you'd like to participate in that, just let the office know so we can count your letter towards our total. Letters can be dropped off between the 12th and 21st of this month. So that way they arrive on time. It's a great way to just help make somebody's day a little better. And we'd love to have as many of you involved as possible. We'll provide more details about letter guidelines once you have committed to writing a letter, and we'll get all that information out there for you guys. But definitely let us know if you're interested in participating in that. We also just wanted to touch base that we do have some paid specialty trainings. We offer a paid specialty training in both Alzheimer's and dementia care and palliative care through Home Care Pulse. For those interested in the Alzheimer's and dementia training, you start with an 8.5-hour online course. It's followed by an interactive in-house session where we dive deeper into dementia care and cognitive decline. Once you've completed that, you'll earn your Alzheimer's dementia care specialist badge through the Home Care Pulse. If you'd rather focus more on the palliative care, we do offer an 8-hour training that helps you develop skills for compassionate end-of-life care. By completing that, you'll also get the palliative care specialist badge in Home Care Pulse, and you get paid for those. So if you're interested in either of those trainings, let us know and we will get you set up for that. All right. And then we want you guys to stay connected with us. We want to make sure you always have access to important updates, training opportunities, caregiver resources as part of why we send out our monthly newsletter. So if you guys haven't checked that out, you guys can scan the QR code that we have here on the slide. It does have this month's newsletter there. We send that out monthly. Definitely want to look through that because we have lots of great things in there, any upcoming events. We also have our Facebook community for caregivers. It's the Right at Home Englewood. If you guys scan that QR code, it will take you there. You can become a member of the Facebook group. It just helps you connect with others and get support from us. You see all sorts of our events that we have going on. If there's any messages that go out, we have birthday messages to all of our caregivers. We're going to be putting, Caregiver of the Month up there. We're going to have newsletter link up there. So it's going to be a really good resource for you guys as well. And speaking of Caregiver of the Month, we do want to take a moment to recognize our Caregiver of the Month this month, which was Sally, and just want to thank you for all of your dedication, your kindness, and all of your hard work. And then, speaking of being appreciative of all of our caregivers, we did have a great time at our Dunkin' Donuts coffee meetup yesterday. It was wonderful. We had so many people show up. It was good to talk to everybody and just take a moment to be able to appreciate all of the work that you guys do. We will be having some more communications coming out this week for some caregiver appreciation. So just keep an eye out from anything for the office on that. And then you will get, you want to make sure that if you've watched this video and you have completed the online course, just go ahead and send us a text or an email with your name and the word heart, and you will be paid for the in-service. So you text the main line number with that and your name, or you guys can email into the recruiter at rahswfl.com email address. If you guys have any further questions or anything, you guys can always give the office a call. And again, thank you guys so much for all of your hard work. And